Normal heart sound. The opening of the valves makes no noise because this is a relatively slow process. However, when the valves close, the veins of the valves and the surrounding fluids vibrate under the influence of sudden pressure changes, giving off sound that travels in all directions through the chest. The closure of the AV valves, or mitral and tricuspid valves, produce low-pitch and long-lasting sound, which is called first heart sound, or S1. The closure of semilunar valves, or aortic and pulmonary valves, produce high-pitch and short sounds, which is called second heart sound, or S2. Now, let's listen to the S1 and S2 sounds, which is lap and dap.